Thank you, Mr. Wall. Mr Speaker, I'd like to contribute to this matter, asking the McGowan Government to prioritise regional healthcare funding and services, including palliative care, in the 2018-19 state budget. Yesterday we heard Minister Cook advising that the Ministerial Expert Panel on Voluntary Assisted Dying had been formed, and he said, I quote, "At the same time, palliative care will be strengthened and continue to be provided for those at the end of life. Nothing in the legislation will be construed to permit a lower standard of medical care. Further details about our government's focus on palliative care will be announced in the coming months." Mr Speaker, in regional areas, a diagnosis that involves terminal illness for people living in rural communities usually and often results in extraordinary levels of stress for both patients and family members, stresses which are enhanced and increased by the logistics of having to relocate, often to the Perth metropolitan area, leaving behind their homes, their families, their communities, and often going to a foreign environment. If they're lucky, they might stay with some family or friends, but quite often they'll be in some facility of some sort. So since I've been elected to my post in the area I represent, I've had some heartbreaking stories about people who have been at the end of life, who have not been able to access services. Some of these people are health professionals. They actually know how the system works. They can't get help for their family members. This is a really dire situation that exists now, let alone what's going to happen after the end of life committee's made its findings known. I know that there are real areas of unmet need for palliative care in regional Western Australia as we stand here today. In my own area, where I represent, we don't have the system of hospitals that are often found in other areas, and many of the coastal communities in my electorate are serviced by small nursing posts or health centres where there are no inpatient services, any hospital beds, so to speak, where people can go. And often for the people in those areas, they haven't been able to access any meaningful palliative care in the past. And some of these areas are not very far from Perth, even just outside of Perth, in places like Bindoon and Gingin. Those sort of areas there, they fall outside the Perth metropolitan area. Service delivery from Perth is not available to them. There's nothing in their local area to speak of. There might be some sort of service over an iPad. That's a lot of use, an iPad to speak to. But face-to-face services are very limited. And so those people need often to relocate to the metropolitan area to get their services. And sometimes they come to Perth for an appointment, they never go back. I know of people who have come down here and been told, no, you have to relocate to Perth, you undergo treatment, they go through the period of treatment, and then they enter palliative care in Perth. They never go home to their communities. So we had, as a government, introduced in my area, Turquoise Coast Health Initiative, $22.46 million program over 4 years, which not only looked at palliative care but also emergency and acute care, short stay and community-based care, rehabilitation, community midwifery, physiotherapy, social work, aged care and seniors' mental health. A wide range of services which are simply not available in the area that I represent. Then what happened when this government came to power? This government cut those services and in fact left that program with nothing but some hospital beds in Dongara, for which I'm very grateful and the Dongara community are grateful, but the other $21 million of funding was cut from that program, never to be seen again. I actually had a look at some quotes that have been coming from the other side when they were on this side of the chamber. In 2010, the now Premier said in this chamber, "For people who live in the country and those who live just outside the metropolitan area, there can be no greater issue than the provision of health care. The lack of that care, of course, can be a life and death issue for people living in communities through regional WA. And yet, when you come here, what do? You cut hospitals like Laverton. You cut the program for Turquoise Coast Initiative. You cut services to the most vulnerable members of our communities. And this all in the face of a Premier who, when he was in opposition, was calling for that to be a priority. I brought to this House a grievance for the Minister to consider back in 2017, I think it was, and the Minister at that time gave an understanding that he would not forget about the matters that I had brought to him in the Turquoise Coast Initiative, that he was going to work towards getting a proper analysis of the priorities and fund them, and see if he could fund them in future budgets. So I'm asking that he actually do that he look again at those priorities and, as he promised back then, to actually ensure that they are included in future budgets. He also said that he personally visited the facilities early in 2018 to gain a better understanding, but I don't think that actually happened, Minister. So the invitation's there. Come up and have a look and have a talk to the people in my area. They'd love to talk to you about what's required for them. But given what you've already done, given the cuts that you've made, how can the people in my area and in the rest of regional WA really believe that, that you're going to make sure that there's decent palliative care available? That when this assisted dying legislation is, if and when that goes through the Parliament and that becomes available, I don't want people in regional areas to face the choice of unremitting pain, unserviced pain, palliative care that's not available, or to have to resort to assisted dying because that is preferable to the misery that they are presented in their own regional areas. That's not good enough. I urge the Minister for Health to follow his own advice, which he gave in that same debate in 2010, when he said to the then government, get serious about our country health service, get serious about West Australia's health system, stop playing politics with our royalties for regions. Well, Minister, it's time for you to get serious, and it's time for you to ensure there's a high standard level of palliative care available to all West Australians, no matter where they live.